Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Tracy, while most of us realize that changing our diet and increasing our activity level would improve our health, saying it and doing it, of course, are two different things. But the Mayo Clinic Healthy Living Program, it's a relatively new program, but it is aimed at improving a patient's health through three pillars of wellness: physical activity, nutrition, and here's one that I haven't heard too often: resiliency.
In the Healthy Living Program, a team of experts work one-on-one to design individualized wellness plans and provide ongoing support even after participants return home and jump back into their busy daily lives. Here to discuss the Healthy Living Program and the physical activity component of that program is Dan Gaz. Mr. Gaz is a wellness expert specialist at Mayo Clinic. Welcome to the program, Dan. It's nice to meet you.
Thanks for having me.
Hey, Dan. Good to have you.
Thanks.
So you are I think it's wellness exercise specialist. Is
Yes,
that your title?
That's correct.
All right. What does it mean? And tell us about the program that you are involved in.
So the Healthy Living Program is relatively new, like you mentioned. It sits atop the employee facility, the Dan Abraham Healthy Living Center. And Mr. Abraham was very grateful and gave us some more money to open this vision of wellness that he had for the employees to the whole community and beyond. So on a daily basis, we see individuals that are with us for one day, for maybe 8 hours, all the way up to 4 days for one of our programs called the Signature program. So depending on what their goals are, they come to us to look for ways to improve their sleep, improve their resiliency, improve their physical activity, their nutrition. So it embodies all of our pillars of wellness. And on a regular basis, my role is to do some physical activity assessments, and that ranges from cardiovascular testing, so a maximal treadmill test or bike test. We do DEXA scans for body composition, so folks know, unfortunately, they don't like these numbers, but how much body fat they have and how much muscle they have. It's a very humbling experience, but a great place to start for someone that needs to figure out how to lose weight and also increase their lean muscle mass, because it's a really important thing to have as we age.
I don't need Dan to tell me that I need to be exercising more. It's been a bad year, as I say. Just like last year was kind of a bad year as far as it all goes. But how is this different, or how does it help someone who obviously knows I need to get myself into shape?
The biggest thing is the level of accountability that our guests get. And it's important to note that we don't call them patients because it's a wellness-based, where there's no diagnostic component to anything that we do. It's all preventative medicine, wellness-based types of assessments. So if someone comes in and they know that they have a wonky knee, we'd send them to orthopedics if they needed a further evaluation. But folks that come to us get these assessments, and we actually give them wellness coaching, whether they're here for a 2-day or a 4-day visit. They get a wellness coach for 6 months up to a year for follow-up. So there's this inherent level of accountability in terms of our wellness coaches that are talking to them every week, following up with them, making sure they're meeting their goals and achieving these things we call experiments.
When you say they or guests, who are they?
They are everybody. We are open to the public. It's a cash model, so we don't take insurance at the time. So we're taking anyone that wants to come to us and that is looking for an overhaul, essentially, in their lifestyle, whether it be physical.
Why did he look at me?
Because you got the fat wallet.
I'm just sitting with my face looking down. But is it really, as he just said, the fat wallet? Is it something that is cost prohibitive? Are you finding people that are saying, this is exactly what I need?
We are finding people that are committed to seeing a healthy lifestyle change. And if that means that they have the means to do so, that's one way. But we're also seeing people that have saved for quite a bit of time to invest, literally and figuratively, into their health. And that's the most rewarding thing, is when you see folks come in and they're there and they're 100% committed to me, to lifestyle change, to our wellness coaches, to our staff, to following up with anyone they need to follow up with when they leave. The biggest thing is we can do as much as we want when they're there, but when they leave, we can't move in with all these folks. We've got to help them.
Okay, so medical insurance, health insurance does not cover what you do.
No.
Okay, so it's cash up front.
Yes.
And you can sign up for, did you say a 2-day program or 3-day or 4-day? Tell us how that works and what programs you have available, and give us the estimate for the cost.
Sure. So the least amount of time someone can spend with us is part of our assessment packages. We have 2 of those. One of them is the enhanced package, one of them is the optimized package. And essentially, folks go through all of our battery of testing, and they are focused on physical activity. There's no nutrition or wellness coaching or resiliency component. those range between $500 and $800 to spend 5 to 8 hours with us.
Okay, so one day for $800.
Yes, sir.
All right, and that does it. That's pretty much exercise based.
So they would go through all the assessments, and they would leave with a plan in their hands and an email from us with plans to follow, programs to follow. And depending on what their level of exercise experience is, we can get very detailed, 1 to 2 to 3 to 4 days worth of exercise. But if we notice, and we can typically do a good job of noticing this from the beginning, people that are scared of exercise or haven't exercised in a while, that's not the best approach to give them. So we can generalize it and make it very, very doable for when they go home.
Okay, so that's the one program. Then what are the alternatives?
So there's a 2-day Mayo Clinic diet experience, and that's based off the very successful Mayo Clinic diet book. And folks there are really focused on losing weight. Prerequisite for that is they have to finish phase 1 of the diet book program, which means they have to finish the lose it phase. So they need to really be steeped in the mindset that Dr. Hensrud and others have really focused on in that book, that very successful book. That one runs about $1,000, but I'm not 100% correct.
So that's 2 days. So you get both nutritional advice plus exercise?
Plus
Or no?
exercise, plus a wellness coach for a year follow-up.
Oh, wow. But via the internet, email.
Email or over the phone, but then they actually have sessions when they're on site in person.
I thought maybe they were going to come into Caribou and drag me out of there.
So we got the 1-day program, we got the 2-day program. What else?
We've got the signature program. So that's 4 days. It encompasses all of our pillars of wellness, so resiliency, physical activity, and nutrition. They spend a lot of time in didactic learning sessions with a lot of our experts talking about some of Dr. Sood's principles with SMART, healthy sleep, a lot of things like mindful eating. They get to meet with a dietitian, follow their food journals, meet with folks like me and a physical therapist, go through a full movement screen, get some very specific, tailored to them cardiovascular experiences and physical activity, strength training experiences. And they also get the wellness coach for 6 months follow-up after that, so once they leave.
All right, so the folks that are listening, because we're on over 100 stations across the country that are unable to come to the Healthy Living program or for some reason do not want to come to Rochester, Minnesota in January, what can they do at the beginning of this new year? It's always resolution time. For me, I have found nothing helps than having my cholesterol checked or having some sort of, a baseline thing where you say, this really needs to be addressed. But what are some things that people can start looking at as their, to jumpstart?
The biggest thing is to make it past February 18th.
February 18th is the day?
That is the day that fitness centers see a very steep decline in member attendance.
That's when I usually start going back to the gym. It's after that day.
But really the best thing is to think about what your plan might be. Start with SMART goals, so something that's very specific, something you can measure, something that's attainable. You wouldn't want to say that I want to run a marathon tomorrow. Start with just trying to walk around the block if you're not active, then incorporate some walking and jogging, doing different kinds of things that interest you. Especially here, it's hard to get outdoors, but if we find things that we like outside, it's easier. Work out with friends or a spouse. Adherence rates are very high when you work out with someone. Go to classes, even invest money in a personal trainer or programs like I just talked about, because research has shown that if you have a financial incentive, you're going to do better.
All right, well, we know it's warm where you are, so it wouldn't be the worst thing to come to Rochester, Minnesota in the winter and take the 1, 2, or 4-day programs.
Be indoors the whole time.
Yeah, exactly. So I want to know contact information. How does someone get a hold of your program, contact you to potentially become a guest?
So you can get in touch with us over the phone. We have a great sales team that tailors all of their experiences to the questions that they ask. They have a very strategic plan as far as feeling out what program's best for the folks that call.
And what's that number?
507-293-2933.
Or the website is, if people want. Go ahead.
I think it's Healthy Living Program.
It's healthyliving.mayoclinic.org.
I have it bookmarked.
Okay.
But there you can see a great outline, and we like to call it our car wash. So if you ever go to some of those car washes, you can pick between all the different options. We've got it laid out there for you. You can see what's best for you from an assessment package standpoint and also from our diet and signature experience.
All right, Mr. Dan Gaz, a wellness exercise specialist, part of the Mayo Clinic Healthy Living Program. Thanks so much for being with us.
Thanks for having me.